Start with the head and then we'll go down, okay?
Okay.
Palpating the head for any tenderness. Do you feel any pain?
Mm-mm.
Have you had any head injuries?
No.
There's no. I'm going to now look into your ears. Do you feel any pain in your external ear when I palpate? Okay. Check your sinuses. So do you feel any tenderness here in your frontal sinus, ethmoidal sinus, maxillary sinus? Okay. I'm also going to check the TMJ at the same time. That is checking trigeminal nerve. So do you have any pain here? Can you open your mouth? Close. Can you put your jaw side to side? Okay. No popping or clicking. Sharp or blunt?
Sharp. Sharp. Blunt. Sharp. Blunt. Sharp.
Okay, good. So try and tell me what you taste. Just salty, sweet, sour, whatever.
I think it's kind of salty. Or is it sweet?
That it is sweet, but it's okay. Maybe with lymph nodes now. So we'll start with the occipital, then post-auricular. Tell me if you feel any tenderness. Pre-auricular, parotid, submandibular, and submantle. No nodes are felt. And we're going to do the posterior cervical, and then the anterior cervical, and then the supraclavicle and inferior clavicle. Now I'm going to check the spinal accessory muscles. So can you raise your shoulders? Okay, good. Can you turn your head that side? This side. So spinal nerve. Can tell me what this is?
A quarter?
Yes. So a good stereognosis. I'll have you close your eyes again and tell me what I wrote on your hand.
An 8.
Okay, so that was checking for graphesthesia and that's intact. The plantar reflex.
Hopefully I don't kick through the face. Ah, it tickles!
Okay, good. Okay, good. And the Achilles. Okay.
Petit état des lieux, voir les fragilités au niveau du corps. Et puis je vais relancer un petit peu les facultés d'auto-guérison du corps, drainer et lâcher prise bien sûr et détente au rendez-vous. Donc là, je suis en train de travailler justement pour détendre un petit peu votre pied, je le prépare pour justement après le stimuler les différentes zones réflexes, donc qui correspondent aux organes, aux glandes et aux tissus. Alors là, je vais passer sur la colonne vertébrale. Donc on est au niveau des cervicales, au niveau du cou. J'arrive ici au niveau des épaules, les omoplates, le milieu du dos, un petit peu par là aussi. Hein.
Ouais, là j'ai une petite douleur.
Ouais, vous sentez bien, donc là je le sens bien aussi. Coccyx, c'est un petit peu là aussi.
Oui, là.
D'accord.
Ou là on le sent.
Donc
là, je sens une petite douleur.
Je viens croire. Donc là
aussi.
D'accord, donc parce que le premier jet est toujours un peu plus douloureux, c'est normal, mais au fur et à mesure, bon, ce pied-là, c'est toujours le premier à prendre. Hein. Après, on passera de l'autre côté, ça fera moins mal. Alors, la réflexologie, c'est particulier parce qu'on passe sur des zones, justement, où la circulation énergétique n'est pas forcément bonne. Donc, du coup, on débloque, on relance. Et donc, ces endroits qui sont un petit peu douloureux, eh ben, c'est des endroits, justement, où le chi ne circule pas très bien.
Great.
Come on forward here in the machine and just put your chin on the cup and make sure your forehead's all the way up so I can see. And then just try to look straight ahead first, okay? And the light's really bright. I know your eyes are dilated, but just for a few seconds I gotta take a good look. Oh, wow. Who did your cataract surgery?
I don't know if you know him, Dr. Steve Shanebaum.
Dr. Shanebaum, do I know him? He is the best cataract surgeon. He's phenomenal.
Oh, he did a great job. I could see so well now. It's really good.
Wow, he did a great job. Both of your lenses just look perfect. How did you end up at Dr. Shanebaum's?
Oh, Dr. Fill in the Blank.
Dr. Fill in the Blank? Oh, fabulous. She is the best optometrist, probably the best in all of southeastern Michigan.
Yeah, I thought she was fantastic too.
Oh, you're so lucky to have such two really good doctors. All right, let's keep looking now. All right, just look right over here at my ear and keep looking straight ahead. So what I'm seeing so far is that the gel that fills the eye, the vitreous gel, it's shrinking a little bit, and it's a normal change. It just happens. And keep looking straight. Okay, now go ahead and look way up high, and then look up and to the left. So I'm looking for any parts here that may have torn or detached. Sometimes when the gel is shrinking in the eye, you can get a tear or a detachment. Look to the left. I'm not seeing anything bad so far. Doing great. Keep looking down and left. I know it's really hard with these bright lights and the dilating drops. Keep looking straight down and down and to the right. And look way over to the right side. So I see that the gel inside of the eye has separated. I'm not seeing anything bad so far, but we need to look at you with another light. And with each of these lights, I see a different part of the eye. So go ahead and sit back, and then let's take a look with the next light. Okay, go ahead and look up for me in just one drop. Okay, go ahead and wipe that. And it's going to sting for a second. That's a little bit of anesthetic and just keeps you comfortable. And I'm going to lean you back. So this next part, I'm not going to hurt you at all, but you're going to feel me pressing a little bit on your eyelid. And you're just going to feel a little bit of pressure, but nothing bad. You doing okay?
I'm fine.
All right. And I won't hurt you at all. You're just going to feel me pressing real gently on your eyelid. And that drop that I gave you really helps. It keeps you real comfortable. All right, go ahead and look down like you want to see your left shoulder. And use the other eye too. It really helps. Just try to imagine you're looking down and to the left. Great. Look straight down towards your toes, right in the center. Good. And look down at your right shoulder. Okay, keep looking down and to the right. Excellent. Okay. And now look way over to the right side. Try to see your right ear. Keep looking that way. Fabulous. Good. And now look way up and to the right. Good. And up at the very, 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 very top of your head. Straight up as best as you can. Good. Keep using both eyes. You're doing great. Excellent. Look way up and to the left. Good. And straight over to the left side. And one more time down and to the left, and we're almost done. You did great. Excellent. That's really hard to do. Good job.
Next, can you puck your lips and smile like this? Good job. Next, good job. Move your jaw around like this. Great. To bite down on this as hard as you can, and don't let me pull it out. Great. I want you to open your mouth and don't move my hand. Good job. Next, click your teeth together like this. Good. Stick your tongue out like this. Good job. Go like this. Good. Have your tongue hit the roof of your mouth like this. Good. Next, I'm going to put the tongue depressor, and I want you to push on it as hard as you can with your tongue. Good.
So if you could just open your mouth and say ah for me. Very nice. Just drop the tongue. Excellent. Okay. Everything looks good. Okay. So if you could just open your mouth again. Okay, I'm going to slide the tongue depressor to the side. And if you could just close, give me a good look at your bite. And same thing again for the other side. Just open wide and close. Very good. Have you close your eyes. Well, you can look for this part. So I'm going to take this swab here. I want you to close your eyes, and I'm just going to touch parts of your mouth. And I want you to just point to the area in which I'm touching. Okay? So close your eyes. Great. Excellent. Could you open your mouth for me slightly? Good. Good. Yeah, it's not comfortable.
No one tickles.
Great. The swab, I want you to just place your tongue there. Okay? So, one more time. Good. 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 Great. Something called tongue thrust. So, I'm going to place my index fingers underneath your jaw, and can you just give me a smile? Great. And I'm going to hold the bottom lip down with my thumb, and I just want you to try and swallow for me. Okay.
To the left, I'm going to touch your baby. Okay. While I'm okay, now I'm going to go ahead and touch your
You do mind? Oh, please go ahead. Okay, that's midline. Can I have you turn? Touch. Okay. All right, here we go.
so sorry. I checked Perla.
Yes.
Wrong. I'm going to continue treating the cranial nerve. Yes, and crown.
There. Got it. All right, I'm gonna feel your arms down. Just make sure there's nothing going on here, any scars or anything like that. Can you lift your arms for me, please?
And do you know what time
Good.
of day it
This
is?
one.
Okay.
Good. Okay. No. Good. Pulmonic.
I'm seeing that your
good.
facial features are also symmetrical.
Tricuspid. It's
I'm going to go
good.
ahead and start with
Mitral.
your eyes. So I've got my
It's
pen
good.
right
Okay.
here.
No
You can just look across.
pulsations.
And symmetrical.
Skin is warm, pink and dry. Color matches ethnicity.
No history of surgery. Eyes of Perla. Vital signs are
No edema. So like 0.
no history of surgery.
Lift the top side of your feet against my hands.
Yes.
All right, and then go ahead and push against them. Good, good. Strength +5. Okay, I'm gonna feel your dorsalis pedis pulses. Okay, equal bilaterally, +2, +3, +3. And I'm gonna go for the posterior tibial.
Two sounds. There was no splitting, no murmurs in the lungs. There was no
There they are.
diseases.
Okay, everything appears to be good. Very good. I'm gonna do a capillary refill.
Negative for pronator drift.
Good. Good. All right.
Really close to you, I'm sorry. But I'm going to have you follow this pin light without moving your head.
Okay.
Just follow it with your eyes, okay?
Okay.
And I'm going to just touch your face with your eyes closed.
Okay.
And I just want you to say yes when you feel it, okay?
Okay. Yes. 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 Yes.
Okay, thank you. And now I'm going to touch your jaws with my hands, and I just want you to clench your teeth, okay? Okay, perfect. Perfect. I'm going to do the same thing with your face, just kind of push against my hand. Perfect. Okay, thank you. So this is a sharp sensation.
Okay.
Okay? Can you feel the difference?
Yeah.
Okay, so I'm going to have you close your eyes.
Okay.
And I'm just going to do it on your arms, and then I'm going to move to your legs, okay? And you just tell me if you feel dull or sharp.
Sounds good.
Dull. Sharp. Dull. Sharp. Okay, and move to the next one. Dull. Sharp. Sharp. Dull. Okay, now I'm going to move to your legs. Sharp. Sharp. Dull. Sharp. Okay. Sharp. Dull. Dull. Sharp. Okay, so you can open your eyes. You got all except one. Perfect. I would give that a 2+ equal bilaterally. Okay. There we go. Thank you. And I would give that a no.
Great, so I'm also going to look at her scalp. I'm just going to check the skin, looks for any lumps, bumps, protrusions. So I'm just going to look at your skin, Brittany. I don't see anything so far. Okay. Yeah. I don't see any nevi. I don't see any lesions, any dry patches or redness. The color of her skin, of her hair, appears to be equally distributed throughout, consistent throughout. I'm just going to feel your facial bones. Okay. Now I'm just going to look at your temporal arteries. Okay, and then I'm also going to test your temporomandibular joint, Brittany. And so go ahead and open and close your mouth. Great, great. And facial bones. Yeah, so lesions or anything like that. Okay. Your eyes appear to be, let me check your lacrimal glands, lacrimal sacs. Did you feel? Yep, I'm going to see that teeth are white. I don't see any cracks or any signs of ear. I'm also going to look at your gums. Okay. I'm just going to, sorry. Just going to pull right back here. Okay, so her gums are nice and pink. I don't see any. What I'm going to have you do is stick out your tongue for me. I'm going to go ahead and swallow for me. So I see the uvula. It's nice. Maybe. There we go. What you do is palpate your lymph nodes, preauricular, postauricular, occipital, superficial, cervical, and down into your deep cervical chains. Okay. And then your posterior clavicle and your supraauricular. And then I'm going to feel your mandibular, submandibular, and your mental. And I don't feel any of them. What I'm also going to do is I'm going to feel for your thyroid. So what I want you to do, Brittany, for me, swallow. Good, and I feel good movement of the thyroid glands, your arms, and then just look under them, Perfect. And check out your back. Yeah, no redness, rashes. No, just say now, okay?
Okay. No. 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 No.
Membranes are pink and moist. Teeth are white, and they're definitely your own teeth. And gums that are pink and moist also. So, start the first field. Normal noises. So if I could just have your hands, please, and flip them over. We're gonna feel for the radial pulse here.
and here. So they're palpable in both places, +2 in quality, which means perfect quality. One more time, I'm going to go ahead and test your capillary refill. Do a little pinch here. And you notice how quickly the blood flow returns?
Yeah.
It returns in under 3 seconds, which is normal. That means you have great, what's called peripheral circulation to your fingers, okay?
Okay.
Can you grip my hands for me, tight as you can? So that's great strength on both sides, +5 strength both sides.
Okay. All right.
So again, great capillary refill, returns in under 3 seconds, which means great circulation to the lower extremities as well.
Hot water, you can do the same thing, just use your facility sink, and you just want to make sure that it doesn't get above 120 degrees. Anything above that can be dangerous. You might also want to consider who your population is. If it's a child or an elderly person, you may back that temperature down even further and not make it side. Okay, and this is going to be the cold.
Oh yeah.
Okay, so she can feel the difference there. For this test, again, I'm going to have you close your eyes.
Okay.
So you can occlude their vision, have them look away, or hopefully they can close their eyes. And you're going to test their different areas, and you're going to touch their skin about 3 times with each test. Okay, so are you ready to start?
Mm-hmm.
And just tell me if you feel hot or cold.
Cold.
Okay,
Cold. Cold. Hot. 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 Cold.
Remember, when you come to, you're on the volar side of the hand, but you're trying to test radial sensation, you want to make sure you're on that lateral side.
Hot. Hot. Hot.
Her sensation is obviously intact, so she's feeling even with
Cold.
one touch. But
Cold.
someone who may be having more trouble
Cold.
may require those 3 steps.
Cold. Cold. Cold.
I could come back up to that C5 on the lateral elbow or that T1 on the medial elbow and test also.
Hot. 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 Cold. 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 Hot. Hot.
Preauricular, posterior auricular, occipital, posterior cervical chain, anterior cervical chain, submental, submandibular, jugodigastric, and shrug your shoulders for me, supraclavicular. Okay, very good. All right, the trachea is firm and midline. Next, I'm going to be palpating your carotid arteries. Okay, the carotid arteries are brisk. And I'm going to have you bend your neck to the side. Okay, and swallow for me. Very good. And bend your neck to the left side. And swallow for me. Very good. Okay. So the thyroid, and I'm just going to be palpating. Okay. I'm looking for any kind of broken ribs or any kind of tenderness. Okay. And I'm going to be assessing the AP diameter. Go ahead and give me a deep inhale and exhale. Okay, very good. The AP diameter is less than the transverse diameter, approximately 1. And I am going to palpate the precordium and feel the apical impulse, approximately 5, the 5th intercostal space midclavicular line, and no thrill is detected. Okay. Next, I am going to be listening to.
I'm gonna start off by looking at your face. So just okay. Thing looks symmetrical. Looks good. Now can you open up for me? Okay. Close it. Good. Okay. No breathing through the mouth. All right. Now I want you to pucker up for me. Good job. Great. And can you just put some pressure on that? Right. Good. Muscle strength looks great. All right. Now can you stick your tongue out again for me? Okay. Looks like you can do that very easily. Doesn't move to the left or right. Can you do it down for me? Yep. Stays right in place. Okay. Now, can you try it when I put pressure on this? Keep it away from me. Stick your tongue out. All right. Yep. Strength is good. Move your tongue tip to the right, like this. Good. Now, can you hold against it? Push, push, push. Good. Just open up again for me. Okay. Rugae looks good. Those are the ridges. Okay. Tricky. I'm going to test your gag reflex. Okay. So if you feel any motion back there, just let me know. Okay. That's pretty good.
Open. Bite. Okay. Open. Open the other side. Bite down. Okay. So looking at her teeth, I can tell that your lips are inside your mouth. So I'm going to ask you to open your mouth and keep your eyes closed. And I want you to raise your hand depending on which side I'm pointing to. Okay. Great. Good job. So Michelle has great sensory awareness as to which side of her mouth
You're seeing fluid dropping into the throat. Okay, look straight at me. Okay, follow my finger. Perfect. Okay, open your mouth for me. Alright. What I'm going to do is I'm going to feel your spine. When you fell, did you hit your head?
No.
Did you hit your back at all?
No.
Anything else in your body hurt?
No.
Okay. I want you to breathe for me. No. Move your toes?
Yes.
Can you feel that?
Yes.
Okay. So what I want to do, is it possible for you to scoot out and lay on your back? Okay. With this hand, can you point to your belly button? Okay. 1, 2, 3, 4. Okay, want to help back up?